Hello, everyone, and welcome to our latest edition of Fields of Study. My name is Max Huber. I'm the Communications and Marketing Manager for the Masonic Cancer Center. We recently sat down with Dr. Elizabeth Neal, an assistant professor with the Department of Neurology, and also a neurologist and neuro-oncologist. Unfortunately, we did have some video-related issues, but the audio was great. So this edition of Fields of Study will be pretty much audio only after this. I apologize about that. We'll try to fix it for next time, but she had some great and insightful information. So I hope that you please do listen to this episode. Check it out. Is my guest today, Dr. Elizabeth Neal. Dr. Neal, thanks for joining me.
Thank you so much for this opportunity.
Yeah, I appreciate it. You are an assistant professor in the Department of Neurology at the University of Minnesota Medical School, as well as being a neurologist and a neuro-oncologist with mHealth Fairview. Going back from that, what kind of inspired you to get into the whole neuro field back from, I don't know if it was the time you were at Detroit Mercy or when you were in Wayne State or Cincinnati, but what drove you to get into this field?
Yeah, I feel that, the drive to go into medicine is a pretty generic reason for most wanting to help others. So when I got into medical school, I really didn't know how exactly I was going to help the patients that I'd be dedicating my professional career to. In medical school, you have an opportunity to rotate through all the subspecialties. When I rotated through neurology, I felt at home. I felt that I was intrigued and challenged by the conditions and the diseases that affect the brain and the spinal cord, and I really appreciated working with the patients and other colleagues within this field. So I decided to match into the field of neurology. From there, I knew I wanted to further subspecialize within the field of neurology. Our subspecialties include multiple sclerosis or inflammatory conditions that affect the brain and spinal cord, stroke, Parkinson's disease or other movement disorders, ALS. But another big subspecialty that's really evolving over the past decade or so is neuro-oncology. And it's the intersection between cancer and the brain. And it was a perfect fit for me. And so then I decided to go into a specialized fellowship, a 2-year training program out in New York City in neuro-oncology, and after that I ended up here at the University of Minnesota, and I couldn't be happier.
That's awesome. May is Brain Tumor Awareness Month, so for people that might not know, or to the layperson, what causes brain tumors, or why would someone get brain cancer with a tumor growing in or on their brain?
Yeah, that's the really unfortunate thing. Unfortunate for 2 reasons. The first being is we don't know why the greatest majority of brain tumors occur. We do know of a couple links. So patients who have previously been treated with radiation and radiation exposure to the brain or the spinal cord can later on, years and years and years later, spark the development of cancer within the brain. And there's also 5% or so of brain tumors are linked to genetic conditions. So in patients who are just predisposed to have cancers, they can have multiple cancers affecting multiple different areas of the body. So they can have colon cancer, and lung cancer, and also breast cancer. But again, that's a very, very small percentage. So because of that, we don't know why people develop brain cancers. And so unlike lung cancer, where we know there's a direct link between smoking and the development of lung cancer, we can't advise people to do one thing or not to do another thing because we don't know why they develop. So it's just a very, very unfortunate circumstance for a lot of patients.
Yeah. And one of the things we have here at the University of Minnesota is the Brain Tumor Program, a group of physicians, researchers that are working to solve the problem of brain cancer. And you're a part of that. This has to be a pretty interesting group. You have some of the people that are actually in the clinic, and then there are the bench or basic researchers that are putting all of their efforts towards solving this problem. Tell us a little bit about that.
Yeah, I feel that the only way we're going to further the field of neuro-oncology and really make the breakthroughs that are going to make a difference in patients' lives is if we have this really strong collaborative effort. And so, without the work that the basic researchers are doing, I couldn't do my job because I wouldn't have the new tools and novel treatment options to offer. But in the same respect, without being guided by, what the needs are in clinic, the basic researchers might be working on something that, really isn't that impactful or couldn't really be used within a clinical setting. So it's working together from both of these very, very different viewpoints that makes this brain tumor program so strong and so effective. It's this collaboration that's led to the future development of a phase 1 clinical trial that we'll have at the University of Minnesota. Basic researchers have developed a immunotherapy and vaccine combination novel therapy that I'm hoping to bring to clinic later on this year. Of course, with the pandemic, unfortunately, things have been slowed down. Researchers at the U have had to close down labs on a national setting. The FDA has slowed down too. So this is just a bump in the road, but we're hoping that as things start opening up and the country starts moving forward, this clinical trial will be up and running, and I'm very excited to be able to provide this treatment option to patients.
You talked about kind of how things have changed. There's obviously a lot of people working from home. How has your situation changed? Are you going to the clinic as often as you normally would? I mean, a lot of us are not able to even get on campus at the moment. So how has your day-to-day structure really changed in this pandemic age?
Yeah, I mean, you can certainly tell by the background, by my appearance that this is a different time. Much more relaxed, working both as a professional trying to care for patients, but also as a mom as well too. I have 2 young girls that we're trying to juggle between daycare and then also having them spend as much time as possible at home. And then my husband as well too is trying to do the same that I am. So it's difficult. I think that the biggest thing that I find most gratifying about what I do is building these relationships and these connections and being able to see somebody and give them a handshake when I come into clinic. I think makes a difference. And now that we've moved virtual, I would say about 80 to 90% of my clinic visits are all virtual. That you're missing that kind of more in-depth connection, and of course it's difficult having tough conversations with people that you might not know very well, or people that you've come to really care for, but yet you can't be there to provide that in-person support. So I would say that it's very difficult, probably in all fields of medicine right now.
Yeah, it's kind of this double-edged sword where you're not able to get in there and meet with the patients, but at the same time, at least we're in this age where there is telemedicine, there is Zoom meetings and Skype, where you can have a conversation, where before it might have been a phone call and you're playing phone tag with someone, or back in the day when you're just kind of out of luck during the Spanish flu epidemic. I mean, people were probably just stuck at home, and I can't even imagine what that was like. So there is some advantage to the age that we're living in, but yeah, it's just tough. Just the personal connection and not having that is, and especially for you physicians, you mentioned it. It's an extremely interesting situation, I guess.
Hmm. Certainly, one that I don't think anyone was ever prepared for. I mean, it was great, the response that the Masonic Cancer Center and the University of Minnesota had to get telemedicine a program that was not even available up and running within weeks, by the time that we knew that we wouldn't be seeing patients in clinic and we needed to move virtually. So I would say that, myself, pretty new, I suppose, out of training. I never trained on a telemedicine platform before.
Yeah, it's interesting. Going to switch gears here a little bit, but one of the most common brain cancers or brain tumors that people hear about is glioblastoma. It's been in the news quite a bit in the last few years. Tell us a little bit about that. We don't need to get into too much depth, but it's one of those scenarios that we're hearing a lot more about as it's affecting some well-known people.
Yeah. I think that's why, opportunities like this, I certainly welcome as a means to increase awareness and education on brain cancer. So is the case when somebody who, is kind of in the spotlight, is being profiled because of this diagnosis. Yeah, glioblastoma, I suppose, has the reputation because it's the most common malignant primary brain tumor, and also because it's very aggressive. We don't have adequate treatment options. We have good options right now to, reduce the growth of this tumor, but certainly far from a cure. And so I think that, the more awareness of this, the more interest, from a pharmaceutical company standpoint, from a research standpoint, the greater our chances are at developing something that's going to really, really make a difference in patients' lives.
Yeah, and just this question popped in my brain: Is there a distinct difference? I mean, there's so many different types of cancer: lung cancer, breast cancer, and they're all different. There's not just one cure-all for cancer that people hope for. Right? Each one has its own thing. But is there something that sets brain tumors and brain cancer apart? With lung cancer, you can go in and you can operate, and the brain is just such a delicate thing that controls your whole body. Is that, I don't know the exact question, but does it make it that much more difficult because of the function that it serves?
Yeah, I would say that there's, two main obstacles in the treatment of brain cancer. The first being its location. The brain is it's a very, very important organ. It's very, very subspecialized. You know, One area controls our ability to understand speech. Another one controls our ability to move. So unlike the lung, where you can live with half of your lung missing and an entire side taken out, you can't be functional with half of your brain removed. So, the limitations that we have as far as surgery are one, just because of how complex and how essential most of your brain is. In addition to that, the brain is protected by something called the blood-brain barrier. The blood-brain barrier prevents the blood flow that's seen within the body from fully getting into the brain. So there's these little gates present, and so only very, very select quantities of your blood are able to circulate within your brain and your spinal cord. And so, a lot of patients ask, I have a friend or a cousin that has lung cancer, prostate cancer, breast cancer, and they have all these different drugs that they've been offered. How come, we don't have so many options when it comes to brain cancer? And the reason being is that, the certain chemotherapies can't cross that blood-brain barrier, so they aren't even seen within the brain or the spinal cord. And if they can't get there, then they can't provide any therapeutic benefit. So those are the pretty big differences.
It's interesting. It's just, it's the brain. It controls, like you said, most everything that we do. So, and the delicateness of it, and I'm sure you can't just go in there scalpels a blazing to try to cut out a tumor, because it's the the cost benefit analysis here. If you did that, maybe the whole left side of somebody's body would just be non-functioning, and that doesn't sound very appealing.
Yeah, and especially too, we're not offering a cure with surgery. So I think that, if we were saying, we could completely eradicate this cancer, but you could be left with the inability to move your left arm, or, the inability to talk, while that would still draw a pause, is that quality of life, that I'd be left with worth it? That would be a question in and of itself. But when we aren't offering a cure, that quality of life is not appropriate, because we're trying to always, maximize the amount of time patients have to live, but you always have to factor in, what quality of life are they left with.
Yeah, interesting take. I want to switch to a lighter side here. A couple years ago, the Final Four was in town, and you got to play on the actual court of the Final Four at US Bank Stadium in the coaches versus cancer game. You have a little history playing basketball, but that had to be kind of a cool experience. Yes, there weren't 50,000 people in the stadium, but by the end of this game, there were like a few thousand people watching you play on the court with Bo Ryan and some other big time celebrities there. It had to be pretty cool.
Yeah, it was a phenomenal opportunity. Yeah, basketball played a major role in my life growing up. It got me a full ride scholarship to play in college, which was great, because then the money that had been saved up, for college, I put towards tuition for medical school. Because, a lot of people who complete medical school, are straddled with a lot of debt. So I think basketball definitely, provided me that financial lifeline. But in addition to that, really drove home the importance of teamwork, of leadership, leading by example, and the fact that, sometimes you get thrown into a situation where, you feel like the chips are down, and you feel like there's no way that you can end this game on a positive note. But if you keep working hard and you rely on, your training, and you rely on your teammates, sometimes you can pull it off.
Yeah, I'm watching The Last Dance with Michael Jordan right now, and it's making me miss sports even that much more. I'm a huge sports guy, and there's just nothing on right now. But watching you guys out there, and I think one of the coolest parts about that game was, yes, we had 3 of our physician researchers there. We had some of the nurses. I think it was the interaction with the survivors, and there were people that had gone through hell, and they were on the court, and it seemed like it was the highlight of their life. They were just having so much fun being out there playing basketball, and it was super competitive. I mean, you guys didn't really leave anything on the court. You might have been the shortest person on the court,
Chances
but
are.
but how was it being coached? By who was your coach for the game? Was it Jim Calhoun or Bo Ryan?
It was Bo Ryan.
That had to be pretty cool, even though he is a Wisconsin Badger guy. That had to be pretty neat having a world-class coach be there to guide you guys through that game.
It was. I think that, we had one very, very short, I think it was like an hour, 2 hour, practice the day before, in which we kind of got to meet each other and, just run a couple drills, loosen up a tiny bit, maybe dribble a couple times, get the cobwebs kind of taken out. But, I think the greatest thing was the pep talks, and just kind of a view into like what a higher caliber coach thinks of, and what they say to inspire their team. I think that was a very, very fascinating opportunity for me. And then, yeah, I would agree with that. Just being shoulder to shoulder with these, people that have been through the treatment, the diagnosis, the ups and the downs, and to play with them and against them, for such a great cause. I mean, it was a great opportunity.
Yeah. It gave, and this will lead to my final question, it gave me hope seeing everybody out there and witnessing that. And I always end these interviews with this, and it's a very loaded question, and it could be, you could take it many different routes, but at the current time and situation in our lives, what gives you hope?
Um, that is a loaded question. I'll agree with that. Um, I think the things that give me hope is the fact that, even though we're staring down, a very, very challenging, difficult disease, as it is with most cancers, but very, very specifically uh, brain cancer, particularly glioblastoma. I feel that absolutely nobody has thrown in the towel. I would say that, everybody is continuing to rise to the challenge. We come out with clinical trials, and we're very, very hopeful that, whatever mechanism it is that we feel will unlock the key to providing, a really, really good treatment option. Most of those clinical trials have failed, but people are working that much harder to find the answers that we need. In addition to that, we have an amazing group of patients that are willing, to take on the task of enrolling into clinical trials so that we can learn more, so that we have an opportunity to help them. And if it's not to help them, to help someone else in the future that would be unfortunate enough to be diagnosed with cancer.
Yeah, I hear exactly what you're saying. I've known a number of people that they knew their time was short, but they did everything that they could to maybe help future people that were faced with the same situation. So the selflessness that we see, one from you as the doctors that are going out there, but from the patients as well, just having the mindset that some people have is actually is amazing and inspiring. So thank you for joining us. We hope that a lot of people were able to get some information from you, and maybe we'll include a link here for information about Brain Tumor Awareness Month. So Dr. Neil, thank you again for joining us. Any last second words before we end today's interview?
No, just thank you again for, the opportunity to speak today. This is another really important time within the year for us here at the university. Brain Tumor Awareness Month, kind of starts putting out information about what we're doing here at the University of Minnesota, and all the steps that we're taking to hopefully, bring forward that big next breakthrough within the field.
All right. Well, we're looking forward to it. Thank you, Dr. Neil. Everyone, we will see you next time on our next edition of Fields of Study.